My team and I envisage that pharmacists can do more in this space, whether it be through community pharmacies, whether it be through home medicine reviews, or pharmacists contributing to positive behaviour support teams around identifying chemical restraint and developing a deprescribing plan of that medication if it is inappropriate, and it often is. It's a human rights issue and it's a quality of life issue because those medicines are associated with considerable harm. So I have a whole body of research in that space. My name is Dr. Manya Angley and I am an Adjunct Professor at University of Western Australia, and I also have a private research and consulting business called Manya Angley Research and Consulting, or MARAC, and I do contracted work or join teams at various universities. My education journey has been somewhat convoluted. So I started as a junior academic and enrolled in a master's at the South Australian Institute of Technology because they didn't have PhDs at the time, and did master's qualifying, converted to a PhD, which I finished in 1995, or was awarded in 1996, and I stayed on at what became the University of South Australia until 2010. I had 3 children and a stepdaughter, and my middle son has autism, and due to family reasons I left that appointment but continued as an adjunct while establishing my own research and consulting business, which gave me more flexibility. For a period I was not affiliated with any particular university, but as mentioned, I've recently been appointed a professor at UWA, so I have research mainly in disability through UWA, while continuing work in transitions of care through other universities, defining the role of the pharmacist in disability care teams. I have done research into quality use of psychotropic medicines and was invited to present as an expert witness at the Disability Royal Commission, Hearing 6, which is psychotropics and behaviour as of concern, which has become a focus of my research. One area of research is exploring the role of the pharmacist in disability care teams. So in particular, increasing uptake of home medicines reviews in that cohort. So people with disability, in particular people with intellectual and developmental disability, have very low uptake of home medicine reviews, but they also have high polypharmacy, in particular high psychotropic polypharmacy. Overall, people with intellectual disability and developmental disabilities such as autism die earlier than their counterparts. They die 27 to 32 years earlier than their counterparts without intellectual disability and or autism, which as a nation, is a developed nation, is shameful. And there is consensus that medication-related harm is a contributor, but so is underdiagnosis of chronic conditions and therefore undertreatment. So my team and I envisage that pharmacists can do more in this space, whether it be through community pharmacies, whether it be through home medicine reviews, or pharmacists contributing to positive behaviour support teams around identifying chemical restraint and developing a deprescribing plan of that medication if it is inappropriate, and it often is. It's a human rights issue and it's a quality of life issue because those medicines are associated with considerable harm. So I have a whole body of research in that space. And then there is the transitions of care research that I do, which is defining the role of the pharmacist in transitions of care, in particular around pharmacists as stewards of transitions of care, medication management at transitions of care, akin to pharmacists as antimicrobial stewards or opioid stewards, psychotropic stewards, anti-thrombotic stewards. So while those are around particular therapeutic groups, transitions of care is looking at pharmacists as stewards of medication management in that area of care, transitions of care. And it's looking at the clinical governance, supporting pharmacists as medicine stewards, initially exploring that role based in hospital with a view to generalising that to the aged care setting and other care settings. I'm a great champion of co-design with the consumers that the research impacts on. I work with a whole range of organisations. Quality use of medicines requires a team approach. The National Strategy for Quality Use of Medicines, which sits within the National Medicines Policy, is all underpinned by collaboration with the consumer at the centre. Speaking about consumer organisations, I partner with South Australian Council for Intellectual Disability, New South Wales Council for Intellectual Disability, disability advocacy groups with respect to disability research, with respect to transitions of care, which impacts on all consumers, Consumers Health Forum, people with lived experience as well, who may not be attached to those consumer organisations. But in addition to that, it is partnering with other peak bodies, so the Royal Australian College of General Practice, the Australian Medical Association, the Australian Primary Care Nurses Association, and so on and so forth. There's no limit to who we would include as our stakeholders, and I'm a strong champion for participatory action research, which is about working with the stakeholders to arrive at solutions that address the needs of the stakeholders and a continuous cycle of improvement. With respect to universities, it's Flinders University and Monash University, Sydney University, University of Western Australia, and of course University of South Australia, which is where my roots are, where I was trained and continue to have strong association with. The passion in my work comes from my upbringing. I'm raised in northwestern New South Wales, outback, on a property. My parents were huge community contributors. My mother was a nurse and a social worker, and they modelled contributing to community life at all sorts of levels, at a health level and at a local sporting community level, at local mental health. And firsthand, I learnt the rewards of contributing to community. So the work that I do in my research and my work is all about enriching the communities we live in and ensuring that those areas of unmet need are addressed in whatever way I can help to achieve that. Outside of work, I'm a nature lover, so I get great pleasure and joy, and it's a circuit breaker from day-to-day stresses to just immerse myself in nature. Particularly have an affinity with water. Grew up on the Darling River and now live close to the beach, so any water sports, but hiking, bushwalking, and spending time with friends and family when I'm doing that is ideal.